Hello, my name is Ezekiel Oburu. I am an orthopedic surgeon at the University of Nairobi, and today we're going to demonstrate how to apply our Volar slab. So we have Zachariah Kimengich who is going to demonstrate, and we have our patient here, Evans, who has kindly agreed that we can use him to demonstrate. So I'll give it over to you, Zach.
Okay, thank you. Our first procedure, we are going to apply a Volar slab splint. So Volar slab splint is one of the procedure of the upper limb, and it's good to know the indication, which fractures, which injuries do you be able to apply. You want to do a Volar slab splint. So one is when the patient has injuries of the wrist, especially swelling, and also the forearm, especially when they are mild swelling, moderate swelling, or severe swelling. So we apply a Volar slabs. This is basically a temporary. Then thereafter, we are going to be able to remove it and be able to give it a complete cast. Complete cast, good.
Yes. Excellent. So what are you going to use, Zach?
Okay, so allow me to take you through the materials that is required to apply on a Volar slab splint. So this is a soft band. It comes in the different sizes, just the way Dr. has mentioned. They are 2-inch, 4-inch, 5-inch, and even 6-inch. Then also you require a crepe bandage, which is also very important to be able to secure your slab. So crepe bandage, this is for 4-inch. And also have 6-inch or 8-inch. Then already we've already measured our POP bandage or plaster of Paris bandage in a slab. So when you're putting a slab, you have to make sure that you measure these layers. So these are the layers. We normally make layers 1, 2, 3, 4. You can make around 4, 5, or 6 layers.
Now, so, Zach, I'll interrupt you there a little bit.
Yes.
When you're measuring, where do you measure from? How do you measure a application? Maybe you can show with Evans.
Yeah.
Where do you measure how long will the slab be?
Allow me to, this is our patient. Positioning is very important in every procedure when you're doing plaster of Paris application. So positioning of patient is very important. Let's say this is an injured part. So basically, if you have to use the other normal hand. So when you want to apply a Volar slab splint, it's very important to know where you're supposed to reach. We normally reach at the metacarpal phalanges, which is at the knuckles here. Then should be actually below 2 centimeters at the elbow. So you should not be able to go beyond that. So measure 2 centimeters below the elbow, and then at metacarpal phalangeal joint.
And I believe that that is to enable you to move the elbow. Yes. And also to enable you to move the metacarpal phalangeal joint, so that even as you're splinting the arm, yes, you still have range of motion, which is very important. So Zach, maybe you can show us how you go ahead and apply.
Yes. So positioning of patient, I say it's very important. Let your elbow at a table, you can be able to see this table. Then, of course, when you're doing a procedure, you should always have an assistant in each and every, when you're doing a procedure, which together with me is Dr. Buru. So what we normally do, we first make sure that we apply our orthopedic padding in 50%, ensure it's 50%.
Move you like this a little
yes. bit. So ensure it's 50%, then apply 50% overlap. Avoid wrinkles, very important for that, because it will be able to provide some plaster sores. So we normally apply this soft band, but basically, as we wait for the stockinette, the first thing we normally apply stockinette first. Then thereafter, now we apply soft band. So we are still waiting for
stockinette. But sometimes a stockinette may not be available.
Very true.
Because so if the stockinette is not available, yes, it doesn't mean that you have to have a stockinette. Because I've worked in many places where stockinettes are not available, so you can still apply it with the orthopad, yeah, and everything. That's good.
Because stockinette is very expensive, and not many hospitals can be able to actually afford. Okay. Then another important thing, after now you've applied, this is the first one that normally comes. There's these prominent areas that you need to be able to secure around the wrist joints. Prominent areas are very important in every place. So ensure you apply padded, but not a lot of padding. Okay. Then from there, now after you've pad the first soft band, then now you have your slab, which is POP slab. So there is a way we normally make sure that you hold it, and then we have our water here. Basically, when you are using water, it's always said you need to have lukewarm water. And basically at a room temperature of 22 to 25 centigrades. So we want now to apply our Volar slab splint, and it's very important to know how to dip our Volar slab splint. We normally dip vertically 45 degrees. It's very important on that. So allow me to be able to dip it. Allow it for some few minutes. Pumbles to be able to come out. So I normally count 2, 3, 4, 5. Then squeeze it, but not so much. So this is our slab, and then now just make sure that it's molded nicely. Then from there you have it apply your Volar slab at the knuckles there. Then ensure it's come all the way covering at 3/3. Then after now you've applied that, you get your clay bandage. Always it's said to always start from distal part, and especially fracture side. So distal to proximal. Then when you're applying your clay bandage, ensure you don't tie it. The first roll of clay bandage or even POP, don't tie it. So roll it.
So Zach, as you're applying, you're just going over, rolling it over.
50%.
So you don't want
put it too tight or too loose.
The crepe bandage is not for tightening; it's just to allow you to secure your slab, like Zach had said. So it should never be tight.
Yes, because there are always complications when you really apply tight of the cast.
Right. It should never be tight, because if you apply tight, you can whatever.
So when you've applied the first roll of clay bandage, you want to ensure that probably you see could be maybe a fracture that was displaced, an unstable fracture. So of course when there are swelling or mild swelling, you may not be able to achieve. So you need to be able to, how do you position your wrist? So it's important, the holding position, you can see the way, because the injury of this patient is actually at a Achilles. This is a patient who came with a Achilles fracture with severe swelling. So want to make sure that try to mold a little bit, just try to mold. This is the way you are supposed to position. Then allow it for it is what's called the setting time and then the trying side. So it's setting for around 3 to 9 minutes. And then at these edges, you make sure you fold. Fold these edges is very important. The edges are very important when you are folding it. You can be able to see this part.
That's good. And Zach, I will just put for you a strapping here.
Yes.
So that it allows your work, so that it doesn't roll out.
Yes.
Okay?
Yeah.
So good.
Yeah. So that is Volar slab splint. We've already finished. And now from there we normally clean, wipe the patient.
That's good.
After you've cleaned, you've wiped, ensure your patient doesn't go with plaster. So ensure you clean it.
That's important. So I think that the thing is, patients, it's amazing the things that really bothers patients, but also we're humans. We want to, treat people well, so it's important to clean.
Yes.
So that essentially is the application of a Volar slab.
Then lastly now you can give advice. It's very important to give instruction how you're supposed to take care of this Volar slab splint. So these are the instructions. From there now after you've done, we normally give an arm sling. It's very important. We are going to get that one later. So an arm sling. Then ensure you give instruction how you're supposed to take care of these Volar slab splints, because there are always complications. Then we are going to be able to follow up this patient in a clinic to be reviewed within 24 hours.
Yes, that's true. Sometimes also we just tell the patient the things to watch out for, and we could see the patient in a week's time. So we tell the patients that watch out that you don't have a lot of pain, excessive pain. Obviously you may have some pain, but excessive pain, you watch out for swelling, you watch out for things like numbness and tingling. And should you have those, then you report to the doctor or report to your A&E. So that is application of Volar slab. Thank you very much, Evans, and thank you very much, Zach. Thank you.